Ever argued with a 4-year-old and realized you're losing? I have. I'm Dr. Jay Rutland, and today on the Health Exchange, we're diving deep into parenting with pediatrician Dr. Lori Livingston. She helps us navigate our kids' health, behavior, and strong-willed personalities while supporting our kids and ourselves. From ADHD to meltdowns in public, this one's for every parent who's ever said, "Is this what I've signed up for?" Let's get into it. Dr. Livingston, or Lori, thanks for coming back.
Yes. Hi. Thank you.
How are things?
Great. Busy with work and summer. Kids out of school. So yeah, lots going on.
One of the things, we talked about pediatric asthma last time you were here, and we didn't actually get into how you got to where you are and why you picked pediatrics in the first place. So why don't you tell us a little bit about that story and how you got it?
Sure. So I found the love of science anatomy in high school. I had an amazing anatomy teacher, and he inspired several of my classmates to go into medicine or the medical field. And then I did this program in high school called the National Youth Leadership Forum on Medicine. That was another inspiring experience, actually seeing what doctors do, got to watch surgeries, thought it was amazing. And then I got into UC San Diego for my undergrad education. I was pre-med. I, like all of us, tried to volunteer and do as much as possible. I joined a group called the Flying Samaritans.
Samaritans?
Yeah, did volunteer work in Mexico, close proximity to Mexico, not just for going out and partying, but
you did
volunteer
go out and
work.
party. Yeah.
I don't know. I was pretty nerdy.
Okay.
But loved my experience in San Diego, learned about, the serving the underserved and how we can make a difference with very little money and resources.
Did you learn Spanish?
I learned Spanish in high school. I actually got through AP Spanish. I didn't actually utilize it until residency, surprisingly enough. But yeah, it's helped.
Yeah, that's awesome.
And then I got into UCLA med school, which I don't think I could do again. I don't know how that happened, but I'm a UC baby, all the UC schools. So UCLA was an awesome experience, more volunteering, a lot of pediatric stuff in medical school. That was definitely my calling. I just gravitated to any pediatric experiences. I worked with kids with autism and neuroatypical kids, ADHD, special needs, and enjoyed that experience at that time.
Why do you think you gravitated towards peds? Like, what do you think about it? What pulls you there?
I think we talked a little bit about this last time. The kids play and keep you young and playful, and it is fun, even when it's difficult and there are challenging behaviors, challenging issues in families. The kids still are resilient and they have fun. That's how they handle all things in their lives, is through play. And so it got me down on the floor playing and out of the stress of med school and residency too. Like, it just brings you back to reality a little bit. Like, these little human beings are the reason that we're all here. We're trying to grow the next generation into happy, healthy human beings. And that just appealed to me. I felt like I could make a bigger difference in their lives. Adults are very set in their ways and harder to make changes. So I felt like parents want to do the best for their kids, and they are willing to make changes usually, even though it's still hard, but they want to make those changes so their kids are happy and healthy too.
One of my favorite things, if not my favorite thing, is I love babies. I love kids. Whenever I see one, I want to talk to it. I want to make it laugh. I want to have a relationship with the kid. I do that to my producer's kids all the time. I just want to pick them up, carry them. And if I thought it was financially possible, I would have 1 million kids, right? If my wife would be able to do that, right? But one of the things I loved about pediatrics is there was always babies. Like there's always like someone who is about to grow up and who's going to get older. So you always got your baby fix and
Yeah.
your infant fix. And it just like even talking about it now brings a smile to my face. Do you think you like as a parent, because again, we all miss the baby stage for a certain extent, right? We don't
Yes.
want it 24 hours a day. We get all
Yes.
that. But like, do you think that quenched perhaps that want as you were evolving as a parent, taking care of your own children who were growing up?
Absolutely. No brainer. That I have friends who tell me all the time, you are so lucky. You get to see babies all the time. And they do. They light you up. They fill you with hope for the future when things don't feel so hopeful sometimes. They just bring joy.
How do you balance parenting, medicine, being a teacher? And I know I can say as a guy, I had kids during training, but like my wife, was doing 99% of it. Like I'm not ashamed to say that. But for you as a mom, like
Mhm.
how did you do all of that?
Yeah, it's hard. It takes a village, as they say. You have to rely on family and friends. My husband is incredible, and he was home more than I was. His profession allowed him to basically work a half day or go to work early and be home by noon. So we had help. We had babysitters, and then he was home a lot when I was at work, and he did an amazing job, and he loves babies much like you. I think it's actually harder now for him that our kids are teenagers, and it's it's much more frustrating for him, and I feel like I'm in the zone a little bit now. Like, I feel like I get teenagers.
You feel like you get teenagers?
A
Dude,
little bit.
share this.
I
Like what do
do.
you like if you were to give me 3 things that I should know about teenagers, like what are those 3 things?
They just want their independence. And this starts when they're 3.
Yeah.
They want their autonomy. But teenagers, it's an even stronger drive to take risks. That's ingrained in their brain development and builds confidence. They have to take risks. But as parents, we are like, no,
Risk
you can't
averse.
take that risk. They want to do what they want to do. They're figuring out who they are. And I think they just get tired of parents and everybody around them telling them what they should be doing. And if we just take a second to understand their perspective, I think it makes life easier.
Okay, guys, episode's over. Perfect mother. We're done. Like that's all you need, apparently. Like Lori's got it figured out. We're good here.
No, but there's conflict in my house every day. Believe me.
How old are your kids now?
My youngest is 13,
Okay.
just turned 13, my son. My daughter is turning 16 in August, and I have a 24-year-old stepson who lives in our house too. So we have 3 children, and 2 bunnies and 2 parents in a
rabbits?
1,400 square foot house. What?
Oh my
That's
gosh.
fine.
Oh my gosh. All 5 of you plus bunnies
Yeah.
are in a 1,400 square foot house.
You just learn to accept that you have very little control.
Wow. So who's more difficult, your son or your daughter?
It has been different at different stages. I would say my daughter, for me, has been the most challenging, and she knows that. I told her I was going to talk about them today. And it started from when she was an infant. I mean, she has just never been the kid who did what you expect and challenged me every step of the way. And she's probably a mini me in a lot of ways, but I think even more so. We always say kids are like a mirror, and they just teach us about ourselves and about the world. And that is absolutely the experience I've had. And she made me a better pediatrician. I had to learn a lot from the people around me because I didn't know what I was doing either. We don't learn this in medical school and residency even. You learn a little bit, but it's not enough. When I started, I didn't have children. I had her 2 years after I started working out of residency. So
you got
I
through
was
training with no
giving
kids?
Yes.
Oh, wow. Okay.
I was giving advice to parents even though I had no children, and it was one of the most uncomfortable things to do as a pediatrician. I felt very comfortable talking about everything else, illness and vaccines, but talking about parenting, what do you say? You learn enough to give some advice, like, timeouts and consequences, sticker charts, the traditional stuff. That stuff did not work with my child. And there was actually a parent I remember from very early on, my first year out of training, who introduced me to what would be called positive parenting, the whole movement of positive parenting. And I thought it was ludicrous at the time. I was like, you can't be positive. They need somebody to tell them what to do. There have to be consequences. It's not all positive. But I didn't get it because I hadn't read anything about it, and you don't learn about it. So that was something that actually ended up working much better for my daughter, that parenting approach. And we're all ingrained with what our parents taught us or how they parented us, right? It comes from multiple generations, how you respond to your children. Mine was very controlling, and that did not work.
But from a pediatric perspective, when you're a pediatrician and you're seeing families every single day with their children, you have to pay attention to the age of the child and the milestones and the behaviors. How do you deal with that? And what do you go through on a daily basis in terms of visits?
Yeah, those are physicals or well checks, as we call them, and they're fairly frequent in a child's life. And we talk about behavior and development at every visit. We talk about what the child is doing then and what to expect before the next visit. And it helps parents to know what normal is. Parents usually have unreasonable expectations of their child's behavior for their developmental age.
Yeah.
Their brains are really not well developed. All of those, what we call executive functions, right? The emotional regulation, being able to remember, working memory, those come later. And people expect a 3-year-old or even a 2-year-old to sit still, pay attention, follow my instructions. It happens in my office in front of my face that these things play out. So it's the perfect place to talk about what are reasonable expectations for the age of your child. But we start talking about behavior really at the 1-year visit, I would say, because when they hit 1, that begins the 2nd year of life, which is the terrible twos.
Yeah.
It doesn't start at 2.
Why are they called
Starts
terrible
at 1.
twos? Like, why are they like, what is it that a child is going through, what the child is doing that makes it so terrible? I mean, we've been through it, but
Yes. They have limited communication usually, and they start to want their autonomy. They have opinions about things. They don't want to be forced to do what we want them to do. So putting them in a car seat, putting them in a high chair to sit and eat, feeding them specific things. Kids revolt against those expectations starting at 1 year old. And
Yeah.
every kid has a different personality, right? Some are more easygoing. And, my partner, Dr. Singh, has 2 boys who are angels. And we are very similar in how we parent, but they just have been more cooperative their whole lives.
So you look at them like, oh my God. Like,
Yeah, we laugh about it, like you get what you get, and you have to adapt to your child's temperament. And again, like, they need us to love them and respect them for the human being that they are. We can't force them to be somebody else. And it took me a while to learn that. Like I said, my daughter, it was about 2.5, 3 years old when things started to get really difficult. And I found myself not enjoying being a parent because I was always angry at something that she was doing. And we were taking things away and using timeout, and it just made her behavior worse. She did the opposite of what they're supposed to do. And it didn't work, and it made things worse. So I had to shift my parenting for her personality and figure out what would work for her. And every kid is different. So it makes it very challenging. But that's a huge thing I love talking to parents about is let's talk about what's going on with your kid and how can we help this child, not what every other child is doing in the classroom. You can't expect your kid to be like all the other kids. So how do you help the kid in front of you? Because they need your love and dedication to them.
So wellness check isn't just about, did your kid get this vaccine? Does your kid have a cough? A wellness check is about, how is your kid responding to the environment that you're surrounding them with? And what suggestions can the pediatrician, can you give the parent in terms of how to cope or deal with how their child is responding? I mean,
Yeah.
it seems like you're a behavioral therapist as well as a pediatrician.
Yeah, I think, every pediatrician has a different comfort level with these subjects, right? Some people gravitate towards other subject matters. They kind of build their own little specialty. Because of the experience I have gone through with my own child, I really love delving into the behavioral aspects of the household for parents. So sometimes things are difficult and I have to refer families to a child psychologist who can spend even more time. But I do like to spend time trying to figure out what works best.
So like when you talk specifically about shifting your parenting for your firstborn,
Yeah.
what specifically did you do?
So one of the principles in a lot of the research that I read and consumed at that time is there needs to be the positive statements need to outweigh the negative in guiding your child. And the ratio that's supposed to be like the magic ratio is 5-1. 5 positive statements, interactions for every negative. The vast majority of parents give their kids the most attention when their kids are doing something they don't want them to do.
Oh,
right? Like
powerful.
we notice when they're doing something, don't eat that, don't touch that. You need to clean your room. You need to do whatever, or we're telling them what to do instead of actually giving them positive reinforcement for the behaviors that we want to see repeated. So when they get attention for the behaviors they're doing well that we like, they want to do those. Kids just want attention. So if we give them attention when they're doing something we don't like picking their nose, it's a good example that my daughter did and ate her boogers. And I loathed it.
That was the first example that you thought of.
That was. I don't know. It just came to mind. And I couldn't stop pointing it out. Like, I wanted her to stop so bad, and she wouldn't do it. And every time I gave it attention, she did it more and, did it blatantly in front of my face. Like, watch this. So you have to ignore the things. It's not dangerous. It's not going to kill her to eat her boogers. So I had to give attention to the behaviors that I wanted to be repeated.
Yeah.
I love how you sat so nicely at dinner and ate with all of us and didn't fall off your chair. I love how you put your shoes on and got dressed and I didn't have to do it for you today. It's just noticing. It's not even, I wouldn't call it praise. It's not a good job, good
Being
boy,
aware.
good girl. It's just like, yeah, this is awesome. What you did is great. And they want to do that again. We all want that. Even as adults, do you want to hear somebody telling you every day all the things that you need to do or you're doing wrong?
No, but you're right. I mean,
somebody could, but
Yeah, no, I mean, even as a husband, when you think about it, like even as a partner, like you want to hear from your spouse, like the things you're doing well, but sometimes, it's kind of society today, right? Society today is so fixated on what everybody did wrong or what they didn't do. Like, right? Because that's what's polarizing.
Yeah.
That's what's out there,
Yeah.
right? That's what's on social media. That's what gets all the hits, is telling somebody they suck,
Yeah.
right? It's never about like,
this
you did
could be better.
awesome. Yeah.
What do I need to fix? Instead of that, like what is going great? And you're absolutely right. These are the same principles for marriage relationship therapy. More positives than negatives, and kids thrive on that too. That made the biggest difference in my household. Just that one principle, to the point where my daughter would be like, "I need you to say something nice to me today." Like if I was too negative, she'd be like, "You haven't said anything nice today." So they need it. And then of course, role modeling
Yeah.
is huge, right? They watch everything you do, and if I yell, my kid's going to yell. If I hit my child, I better expect them to hit in order to
That's true.
control their world.
Yeah.
We really have to show them with our own behaviors what we expect, which is incredibly hard. And nobody does it perfectly, including me.
And I think, again, this is like something that's been more and more difficult to talk about since we have this evolving thought process in regards to gender. But do you think that raising a physiologic male is different than raising a physiologic female, or do all kids feel that way?
Absolutely different.
Yeah.
Those principles are still the same, but I have had to adjust my approach for my son, and they just have totally different personalities. And I think mother-daughter relationship is very different than mother-son. Father-daughter is very different. So those dynamics play a huge role. But yeah, I think biological sex does matter. That being said, it probably comes down to more personality and interests. And I think just following your kid's lead. My son is a very stereotypical boy, and that was hard for me. Like, his room's a mess, and I like to be organized. He loves rough play, wrestling. Thank goodness for dads that like to wrestle. I would be like, ow,
Yeah.
that hurt. Wrestling. Now he wants to play tackle football against my better judgment.
Are you letting them play?
Yeah.
You're letting them play reluctantly.
These are the hard choices, right? There are pediatricians out there that would say no to their child wanting to play tackle football, but I waited for a very long time. I tried to keep him out of it. We did all the other sports: gymnastics, ice skating, tennis,
Those
you
are the
name
first
it.
two things you came out: gymnastics and ice skating.
Well, when my kids were young, I made them do the same things.
Yeah.
That was easier.
Oh,
Like, I was not.
I was
I
gonna
was
say,
like, you both can do swimming. You both can do gymnastics. Yeah. So that's what we did, all those things. But my husband loves football. My
Yeah.
husband played football. He gravitated to that. I waited for as long as possible until he was like, I must play flag football. I want to do it. My friends are doing it.
Yeah.
And you want to follow your kids'
And now he's gonna
loves,
do
right?
tackle. Yeah.
And now, just starting this fall, he will be playing Pop Warner tackle football. And I'm so scared, but it's a popular sport, and soccer causes a whole lot
A whole bunch
of
of concussions. There's more concussions in
and
soccer than in
serious
football.
injuries. He tried ice hockey. That's a pretty violent game too. I think if you put your kid in sports, you kind of expect them to have injuries.
Yeah, my nephew, who's 10, stereotypical boy, ridiculous athlete, really wants to play tackle football. And so, like, I go to his flag football game the other day, and he dominates. He's playing 2 years up, whatever, it doesn't matter. All these parents, come up to me because my brother's gone. That's why I'm at the game. And they're like, oh, I've been trying to get him to play tackle football. Dad won't let him. He can talk to him. And I'm like, no, it's not going to happen. Like, I just know that the accumulation of the hits is what matters, right? It's the accumulation of the hits that lead to the damage. And so for me, starting at 10 is a lot different than starting at 13.
Sure.
And so I'm like, we're not going to, and he hasn't gone through puberty yet, right? So he's
Yes.
still, weighs 10 pounds, right?
Yeah.
I'm like, we're not doing this yet. It just doesn't make any physiologic sense. I've never heard of a phenom at 10 years old. Everybody talks about it when they're in the NFL. Oh, he was so great at 10. Nobody gives a shit. Like,
Yeah.
so it's not like, it's just one of those things for me. So I feel what you're saying. It seems like, though, sometimes for us as physicians, parenting and being a physician can kind of get in the way of each other.
Hmm.
How has that affected you and your practice and what you do on a daily basis?
I think sometimes my kids feel very restricted by the fact that I'm a pediatrician because there are some things I'm very strict about, and that affects my parenting. On the other side of it, I'm pretty lax about some things. I don't worry about certain things that other parents worry about.
Like what?
So things I do still worry about, choking. My kids are teenagers, and I still give them a hard time about putting too much stuff in their mouth and round foods.
Yeah.
It's a bit of a obsession I
Okay.
need to let go of.
You as a 24-year-old?
Helmets, sunblock. Yeah, like I do. Adults choke. It's
Yeah.
scary. I think it's very scary. And then helmets, sunblock, I'm very rigid about those things.
So if you go to the beach for a day, you're like, you better put your sunscreen on.
Absolutely. Have
And
you
do you-
seen the color of my skin? My children look the same. They're very
Do you-
pale, light eyes.
Do you apply it? Are you like, come here, baby? Like, and you just put the sunscreen on?
Not anymore.
Yeah.
Yes, when they were young, of course.
Yeah.
Now it's harder because they do things independently. So it's sunblock before you leave the house, and then the expectation to reapply. And they do come home burnt because they don't reapply and they go to the beach all day.
Or they told you they applied and they didn't.
So, yeah. So there's a constant discussion of, this is really bad for your skin. And do you want to have age spots like your mother? Do you want to get skin cancer? And so I drive them crazy with that stuff because I know too much, right? Whereas other parents might be worried about the sunburn, but not necessarily spell out all of the consequences to their children.
Is that the number one thing that you say you annoy them about when it comes to like medicine and parenting, is the sunblock and the helmet? Are those the...
Oh, there's a lot.
What's another one? What's the one that like you wouldn't think, that I wouldn't think of like at all, and you're like, this is just a pet peeve, like, oh.
So getting enough sleep
Oh, wow. Okay.
has always been huge in our house. And I'm pretty demanding of my patients about it.
Yeah.
So 10 to 12 hours for kids
Mhm.
until they're done growing, which is usually like mid-adolescence. I mean, later for boys, they should be getting 10 to 12 hours. It shocks people how much sleep a growing child needs, but it affects everything if they don't get enough sleep. It affects your immune system. They get sick more often. It affects their mood. They're going to be, much more uncooperative and moody if they don't get enough sleep. It was one of the things with my daughter that we noticed. If she didn't get 12 hours of sleep plus her nap, she was a nightmare.
So
she needed so much sleep. So
if she got up early, you're like, go back to bed.
you can't really control that, right? But yes, I know you're jesting, but basically bedtime was at 7 in our house for a very long time.
7 p.m.?
Yeah.
Until when? Until what age
Like
did you get lax on it? You're like, all
like
right.
middle school.
Okay, so like
COVID years, we got a little lax because they could sleep in. I don't know. It was
lights out, 7 p.m.
7 to 7:30, yeah.
So you'd get home from work at what, 5?
Sometimes my time with them was very limited.
Yeah.
Even 6, we would have, dinner. My husband would try to wait for me to have dinner, but sometimes they had to eat without me if it was a late night. And then I was always there for reading before bed was our routine. I had that with my children, which I cherish those years. They don't want me to read to them anymore, of course. But reading was always a priority, the bedtime routine, and in bed 7 to 7:30. But here's the thing, kids don't sleep in when they're little, right?
No.
They wake up at 5:36 no matter what time you put them to bed. So they're going to be sleep deprived if you let them go to bed later. And all kids run around like little psychos, even though they're exhausted at night, right? Like they don't show you signs that they're tired.
No.
They just all of a sudden conk out if they're overtired.
And every time you ask them, are you tired? They're like, no.
No.
And like literally within seconds, they're like,
yes.
Right? Yeah.
And I notice that for myself. If I get less than 8 hours of sleep, 7, 8 hours, I get sick because I'm surrounded by sick kids all the time. Sleep affects everything. And also attention in school, ability to think. So when we talk about kids struggling in school and behavioral issues at home and at school, sleep is one of the first things that I tell parents to prioritize. So, yeah, I'm still kind of a sleep crazy person.
Now it's time for What's the Buzz, presented by BuzzRx. Every week, I answer a health-related question from one of our viewers. Here's this week's question. Why do some people lose their appetite on ADHD medications? This is a great question. The reason why people lose their appetite, especially people like me, because I take these medicines, is because the way that ADHD medications work is they increase the amount of dopamine and norepinephrine that's available within the nerve synapse. When this happens, because dopamine is responsible for reward in areas of the brain like the hypothalamus, which control hunger, because dopamine's already increased, you've lost that reward. So you don't get the reward from eating anymore. So you just don't eat. The other thing these molecules actually do is they actually slow down gastric emptying. So again, you feel full. That's the buzz. If you have a question, email us at healthexchangepodcast@gmail.com. Thanks again to BuzzRx. Look up your medications on buzzrx.com or the app to see how much you can save. When I was a fellow, a couple stories. I remember being a fellow one time, pulmonary critical care fellow, and one of my friends' wives, they had their baby. In the first 6 months, the baby was, I guess, great, like fine. And 6 months into it, she's on Facebook and she writes this long post, and I actually saved it because it's hilarious. And she's like, "Oh my God, I don't know what to do. Does anybody know what to do? My baby just gets up every 2 hours and she's always crying and I don't know what to do. And is this normal? Is this supposed to happen?" And like, I look at that and my wife looked at that and she was like, seriously? Right. But have you ever had like a desperate parent or
All the time.
right, come in like exhausted? Like, how do you cope with them? Like, they made an appointment for their child, but it's really not for their child.
Yeah.
It's really for them. What do you say to them? What's your strategy in that situation?
Oh man, it's really hard because everybody has their different styles with sleep, right? There are still lots of people that don't want to let their child cry. So they respond to every cry in the middle of the night. And for a young infant, it's appropriate to respond to that, right? But 6 months and definitely over a year, like, kids have the ability to sleep much longer stretches developmentally, so we don't have to respond to every single cry. So I talk about sleep training a lot with families, but parents inadvertently reinforce kids waking up and getting attention. In the first year of life, sometimes it's breastfeeding that causes the most issue because babies are so attached to their mother. And so moms who are breastfeeding, it can be very, very difficult for both baby and mom to have some separation so that each person can get their sleep, right? And the parent's sleep is so important too for their sanity. This is why there's a whole field of sleep doulas, like people that come to your house and basically teach your baby to sleep and stay there overnight so the parents can get sleep.
So you feel like the
you
most
can pay for anything these days, right?
So you feel like the overwhelmed parents most commonly is because of a lack of sleep of themselves or the baby or what have you. That's the most overwhelming parent.
It is. Lack of sleep. It's hard to be a reasonable, patient, calm parent, think rationally when you're not getting enough sleep. And all parents of infants are sleep deprived. But I talk about sleep training starting at 4 months old because you can start working on it if you're willing. A lot of parents have a hard time, though, with letting their child cry a little bit. And it does usually require ignoring their crying a little bit.
Now, you said during training, you didn't have any of your children. You had them 2 years after you started practicing.
Mm-hmm.
How did having a kid and being a parent change the way you practice medicine?
Changed everything.
How so?
I just understood what parents were going through more. The exhaustion, the breastfeeding challenges. And when I talk to new moms about breastfeeding now, you never forget how hard that was. And it's so emotional. Hormones are changing. And so I talk about it in depth because they need somebody to understand what they're going through and also say it's okay if it's not going well. Formula is not evil. It's actually pretty darn close to breast milk these days. But there's this message sent to new moms like you must only breastfeed and breast is best and do it for a whole year and your child is not going to be as healthy or as smart if you don't breastfeed. And that gets ingrained and then there's a lot of guilt and shame and sadness when it doesn't work out. And the vast majority of women struggle with breastfeeding. So, that's just one example of an experience that now I get to share with new families and say to them, like, I get it. And that means a lot. Just that, like empathizing with what they're going through and trying to give them some tools to get through that hard stage because it's just a stage, right? This too shall pass. But in the moment, it feels like it'll never end.
Yeah, I remember I had this moment again when I was training as a pulmonary critical care fellow, and we just had our first kid, and she was probably maybe a year and a half or two, and I was on call in the ICU at night, and she was sick. My daughter was sick, and she had a fever of like 104, like really high fever, right?
Mhm.
Which again, as a pulmonary critical care fellow and as a physician, I was just like, okay, whatever, it's a fever. Like, who cares? Like, they're supposed to have a fever. She got a virus, got to get rid of it. And I was also one of those guys that was like, I wasn't a Tylenol pusher. I was
Mhm.
like, listen, they need to have a fever. You have
Fever's
to
your
create,
friend.
yeah, you have to create an environment that the bacteria or the virus doesn't like, right? You can't take it away.
Yes.
So, I told my wife this and she kind of did that. But then this night, right, it's when FaceTime came out so she could FaceTime me. She was crying and she was having like febrile seizures.
Mm.
So, and then and I remember this and I remember looking at her and I was like, listen, she's going to be fine. But I remember this moment because that was when I finally understood like all these parents that I remember previously, all these events, these situations. And I was like, oh my God, this is not about like, tell me what to do. This is more about, can you understand and empathize with what I am going through?
Mhm.
And so I just told my wife, I was like, all right, just put her in the car, bring her in. I'll come meet you guys in the ER downstairs with the ER doctor and we'll just kind of talk you through it.
Yeah.
Right. And so it just changed my approach, much like yours, which was more of one where the experience that you gain through a situation really does matter. And
Mm.
being a parent and being able to talk to your patients and their family about that aspect of
Mm.
your life, even though you're seen as a physician right now, is extremely important. And it seems like you just have the opportunity to do that every single day. All right. So, a lot of times as an adult physician, and I see some peds, right? Asthma at least. As an adult physician, I get a lot of patients that come in and they're just like at wit's end with symptoms, right? And they have certain joint pains or they're really short of breath and they really don't know what to do and they're just really emotional, they're exhausted, they have all this stress and anxiety over their symptoms.
Mhm.
They come to me and you got to say things like, hey, listen, like, I'm on your side. We're going to get you through this. Here are the 3 things we're going to do. I
Mhm.
promise you these things will help you. Meet me halfway, whatever. As a pediatrician,
Mhm.
especially treating not the peds patients, but their parents, because that's what you're doing most of the time when
Yeah.
you're raising a little child. If you have a desperate mom or you have a desperate parent who is doing most of the caring for the child, doesn't matter if it's mom or dad,
Mhm.
and they're coming in and they're like, this is so hard. I'm not getting sleep. I don't know if they're eating the right thing. A father can say, I don't have a breast. I can't breastfeed. I don't know how to comfort my child. What do I do? What would you say to them?
So, I would say, you know, this moment feels like the hardest thing ever. And I understand where you're at. I've been there before with my own children being exhausted and being worried and feeling like this is the worst thing and how am I going to get through it? But this will pass. This is just a moment in time, and I'm here to give you the tools to get through this particular issue. And there's always something you can do. The best thing you can do is ask for help, which is what you're doing. And I can give you some tips. And if that doesn't work, then come back and we'll figure it out, because there's always a solution and you're not stuck in this forever, even though it feels overwhelming and out of control right now. You are just like all the other parents that I see. You're not alone going through this thing. We talk about this every day with other parents, and we will get you through it.
I have two little girls that are 2.5 years apart. And I remember my wife's father, RIP, he's passed away since, but my wife's father was sick and she had to kind of emergently travel home. My kids at this time are like probably 4 and 2. All right. Now,
It's tough.
right. From a father perspective, I was like, I can handle this. Like, I got a 4 and 2-year-old, right? I mean, this is easy. I can pick him up. I can take him here. No issue with being a dad. All right.
Mhm.
However, I did not understand that I was also a stylist. And so what I mean by that is my kids, who are mixed, right? They have very much hair like mine, right? And so I had no idea how to do their hair. And so that was my biggest challenge. Like the next morning, my 4-year-old was like, Dad, you got to do my hair now. And I was like, wait, what? I was like, what do you mean I have to do your hair? It looks fine. She's like, I can't go like this. So I picked up my kids and I called my boy Devin and I called his wife Melanie and I said, Melanie, listen, I can't do their hair. Like, I need you to help. She's like, just bring them over, Jamie. And so I brought them over and she did their hair. So I think that friendships are extremely important, right?
This is your village. You have to have your village. Yes.
So much so that even last night, my daughter wanted a certain braid in her hair. She's 12 now, right?
Yeah.
And my wife, who can do the hair, right? She just couldn't do this particular braid. She's like, no, Dad, Mom only knows how to do a positive braid. She doesn't know how to do a negative braid. And I'm like, oh, okay. So who did I call? I was like, Melanie, yo.
Some parents don't want to change a diaper and try to avoid that.
Yeah.
We all have things we avoid. Like I said, I'm not really the wrestler parent. I'll do it if I have to. Not anymore. My kids are too big.
Yeah.
But yeah, you have your roles. But yeah, if you're a single parent, which you essentially were, you have to do everything. I'm actually not the chef in our household usually. When my kids were young, they said, moms don't cook. Why is she cooking? Moms don't cook. Dad cooks. Yeah, like whoever their role model is, that's what they think is normal.
My kids say crap like that to me all the time. Why are you doing that, Dad? It's not for you to do. I'm like, what are you talking about? Like, yeah.
So, it's hard though to make time to learn how to do all the things. I mean, I have so much respect for single parents or parents who are essentially single parents because the other parent is traveling for work all the time or, firemen or whatever, right? That's an extremely difficult situation.
And single parents have to it's almost like they have to play two roles. Like they got to be mom and dad,
Mhm.
right? And even though my mom is a great mother, there were times where she had to be a father. And listen, I know that people always like to argue about gender roles in society and all that. Like, I get all that. But what we're basically saying is somebody's got to be like, hey, listen, this is life. Like, you got to be able to get up and handle this.
Yeah.
Right. And somebody's got to be able to catch you when you're falling. Right. And again, in my mind, I look at mom and dad in that way. Right. And so there are those situations where, I remember after this basketball game, I played the crappiest basketball game ever. It was like a championship game and basketball was like my thing. And after the game, my mom looks at me and she says, because my mom was always traveling for work, and she looks at me and she's like, you made me travel all this way to watch you play like this.
Oh, no.
Right. I was 17 years old.
That does sound
But-
like a dad thing to say.
Right. Yeah. And so, but what happened in college and medical school when I had to stay up late and study for a test or push through? I thought about that, which gave me that extra 60 minutes or 120 minutes that I needed
Yeah.
to be able to focus or whatever. And I don't look at that as bad. And I look at that as parents doing what's appropriate for their child. But here's a situation I got for you. We're going to call this Would You Rather Parenting Edition.
Oh, boy.
All right. Would you rather explain ADHD to your in-laws or handle a public meltdown?
Public meltdown.
You'd rather handle a public meltdown? Oh, wow.
I have handled so many public meltdowns, again, with my daughter. Like carrying her out of places, screaming and kicking.
Would you rather have a kid who never sleeps or a kid who never stops talking?
Never stop talking.
I have trouble right now because my 12-year-old does not shut up. But like, I just think to
It's a thing.
myself, I just think to myself, you know what? She's talking. Like, let her talk.
Yeah.
Just listen. Just listen, right?
If you can listen, that is amazing. We don't do that enough, right? Our phones are a distraction. Everything's a distraction. It's so hard.
All right. I got another would you rather. And this is a spontaneous would you rather. Would you rather talk to your teenage daughter about sex or take ICU call in pediatric intensive unit?
Oh my God, that's a hard one. I might rather be on call. It is very uncomfortable.
You look uncomfortable now. You're like, just thinking about it. You're like,
I have a much easier time talking to my patients about sex than my own children.
Have you done it yet?
Yes, but they usually shut me down. They get uncomfortable too. I mean, I think, and even though I'm trying to be matter of fact, I started when they were pretty young, kind of slowly educating them about not just their bodies, but then actual mechanics of sex. And they were not having it. I think they weren't ready developmentally. And it was like, what? Just stop, Mom. And so now I try to trickle it in. One of the best ways is to be watching a show with too much inappropriate sexual innuendo or jokes. And then it's like, hey, let me talk to you about that.
Oh my gosh.
So we watch a lot of comedy. That's often how it comes up, is like just in everyday life now is much easier. I think we have to have it early and earlier and earlier because of the internet, right? Like kids have access to pornography very easily and accidentally at a young age. And we have these discussions at my office with kids that are way too young that just don't have restrictions on the internet. And that can happen easily to our own children, even if you have rules, because they go to a friend's house. So you actually have to have the conversation very early.
Would you rather take your child to the pediatrician or be the pediatrician when your own child is sick?
I would rather be the pediatrician. I am comfortable managing my own child's health issues for the most part. I think it's important to take your child to the doctor as a pediatrician when you are not thinking straight or too worried about whatever's going on. But it's so nice to not have to go to the doctor all the time. And my kids don't realize how lucky they are. Sometimes I point it out to them, like, I can help you with all the things. My daughter at one point, she gets like an itchy scalp and it was driving her crazy. And I had already tried a bunch of different things for it. And she was like, Mom, can I just go to the dermatologist? And I was like, no, they're just going to do the same thing.
Right.
They're not going to. So we solved it. I never took her to the dermatologist for her scalp.
What was it?
It's just like, itchy scalp. Like she needed to like dry her hair before bedtime. And you just try different strategies and that you don't need a specialist for that, right?
No. Yeah.
I need to let it go. And it's very hard to do that.
Yeah, see, you're better than me because sometimes I'm like, dude, I'm the doctor. I know what I'm doing. Like, listen here, like Mrs. Rutland, like it's okay. Like Dr. Rutland got it. Like, like
I do that too.
I'm sure you do. I can hear it in your voice.
Yeah.
What 3 things do you want to leave us with in regards to parenting and being in medicine?
I think it's really important to say, because I've talked a lot about strategies for helping your child's behavior and positive parenting and what not to do maybe. But I think it's important to remember that we are all doing the best we can, and there isn't one right way to parent. And even though your pediatrician or whatever behavioral expert you're reading or seeing gives you advice on how to help your child have the best behavior, we all fail at this every day. You have to expect that you're going to have good days and bad days, and there's always room for repair. It's one of the things that I read over and over again in the parenting research is that when you mess up, it's okay. You are modeling for your children what it's like to be human. You're not perfect, and you're going to do the wrong thing sometimes, whether that's yelling or spanking or, something that afterwards didn't feel good. Then you go to your kid and you say, "Hey, I think I went too far. I messed up. I'm sorry. That's not the parent that I want to be." And that is how you keep your relationship with your child strong.
You brought some books
Yes.
that have helped you along the way.
These were 4 that I read a long time ago when my daughter was 3, I would say. They're not new books. One was suggested by a preschool teacher because she noticed that I had a very strong-willed child and said, "I think you should read this." This might help you.
Yeah.
That was Simplicity Parenting, which actually gets a lot into, how to structure your life to help your child to be successful, how to set them up for success, no matter what their underlying issues are, whether it's ADHD like you had or anything else. The Whole Brain Child, Dr. Dan Siegel is a neuroscientist at UCLA, and Payne Bryson, Dr. Bryson, is also a researcher. They have incredible research. And it's understanding your child's brain development at different stages so that you realize, like, this strategy is not going to work for a 2-year-old. I have to modify based on their development and how to actually explain those things to your child too, so they understand their brains. It's so cool because if your kid understands why they do the things they do, it's so much easier to help them through it, right? And then No Drama Discipline is also Dr. Tina Payne Bryson. Just again, we don't want to be yelling at our kids all the time, right? Like, we don't want drama. It doesn't feel good in your house. So, what exactly can you say and do in different situations to create less drama and help your kids to be cooperative? They're just my favorite books. Peaceful Parent, Dr. Laura Markham, Peaceful Parent, Happy Kids was probably one of the first ones I read too. She actually gives scripts. Like, when your child is doing this, she has a whole website. You can look up, "My 2-year-old is having tantrums. What do I do?"
Oh, wow.
And she gives you a script on how to walk through that with your kid, which is so incredibly helpful. I still use these things with my kids now that they're older because there's advice for having teenagers. And it is incredibly hard, and we say the wrong things sometimes. I still need this education on a daily basis, these reminders. And then Dr. Becky Kennedy is a newer, she's known as like the parenting whisperer. She has a podcast. And I just love her philosophy that kids want to be good. Everybody is good inside. They're not trying to drive us crazy. They want to do the right thing. They just don't have the tools yet. So how can we teach them? And something I remember in my education through this is the word discipline means to teach. It doesn't mean to punish. It doesn't mean, how do I set up consequences for stuff? It's to teach. When we are disciplining our children, we are trying to teach them how to behave in this world.
I mean, that's amazing advice. Much appreciated. As you guys can already tell, reading books, reading in general, kind of gives you the experience that you didn't really expect. So it's very, very important in our lives, and really appreciate you being here. Thank you
Thank you.
so much. Lori, how do we find you?
I am at Pediatric Medical Center in Long Beach is my private practice. And I am on Instagram and Facebook, Pediatric Medical Center, Long Beach as well for those. I try to post parenting tips regularly, which help me and help everybody else. So yeah, easy to find.
You've definitely helped me today. I mean, I'm going to go home and say 5 positive things before I tell my daughter that she did something wrong. Appreciate you being here. Thanks for watching and listening. We're on Instagram at the Health Exchange Podcast. Get us wherever you get your podcasts every Thursday at 6 a.m. Pacific, 9 a.m. Eastern. We'll see you next time.